times get hard, and we're here to help at NorthPoint.
Hello, and welcome to another episode of NorthPoint Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing gender-affirming care with one of our providers, Dr. John Gatermann, who is a supervising clinical psychologist here at NorthPoint Health and Wellness Center. A little bit about Dr. Gatermann. He specializes in working with the queer community, providing assessment and therapeutic services to early childhood and late adult. He works from a trauma-informed intersectional framework, which enables him to understand the complexities of identity and mental health care. Dr. Gatermann founded the 2SLGBTQIA+ committee, which formed in 2018 as a call from NorthPoint administration to better meet the needs of the queer community. Apart from his work at NorthPoint, Dr. Gatermann has been an invited guest lecturer at the University of Minnesota and Augsburg University. He provides training for supporting organizations in becoming more inclusive of queer folks, and he reviews journal manuscripts focusing on sexual orientation and gender diversity. Dr. Gatermann, thank you for being here.
Such a pleasure.
So we'll just jump right into it. Will you please explain to us what is gender-affirming care?
So as a provider for the 2SLGBTQIA+ community, queer community for short, part of my work is providing gender-affirming care services for trans folks and gender-expansive folks. What that means is trans is an umbrella term to describe people who don't identify within the binary, male and female. And then there's different labels underneath that umbrella that help better align with people's identities from more of a personal perspective. And so gender-affirming care is just one type of care that you can provide for someone who's kind of exploring their gender identity. They may be in different phases of that, whether it's the questioning phase or they've moved towards more like the transition phase. And so it really just depends on where the person's at and their journey. So to speak specifically, gender-affirming care can be a whole host of things. It could include mental health. It could include medical transitions. Could include just social transitions with people in your community, people in your support system. Social transitions within school, if you're a young person still navigating the school system, things of that nature. And I can speak specifically to a mental health perspective, being a psychologist. Really what I've come to understand about gender-affirming care is that you are not trying to change someone's gender. Really what you're trying to help them understand is their identity, who they are as a person, and how they want to express themselves to the world. The world interacts with us in all different types of ways. Sometimes those identities are well known. We wear them, whether it be race or our culture. Sometimes they're more internal. And what it really is to kind of help align who you are on the inside with how you present yourself to the world.
That's a great explanation. And I think as a community, can you tell us, why is it important for us to have a better understanding of gender-affirming care in our interactions?
It's a really good question because I get it a lot from parents, and there's always some you have to navigate things from more of a sensitive nature, especially when you're working with young folks, because there's a lot of misconceptions that people come to the table with, and you're really trying to help parents understand what it is we're actually doing. In therapy, from more of a mental health perspective, we're doing just that. We're trying to help the young person develop their identity, right? If you identify as cisgender, just meaning you align with your sex assignment at birth. So if you were assigned male at birth, you identify as male, right? And those trajectories are pretty well established for folks who are cisgender. right? You get to explore that within your school. You get to explore that within your community. You get to explore that within your home pretty freely. What it means to be male, what it means to be female. People identify differently, right? They don't identify within the binary. They don't have a lot of that freedom and latitude to really explore their gender. And so what therapy becomes is more of a vehicle to help them start to understand what their gender means to them, and then how they want to express that to the world.
Wow, that's amazing. Yeah, that's important. So tell me, why is it important for individuals in the LGBTQIA community to receive culturally responsive care?
Yeah, so broadening out back to more of the queer community in general, whether you're, grappling with your sexual orientation, lesbian, gay, bisexual, pansexual, and so on, or you're kind of grappling with your gender, or both, because there's a lot of overlap as well. It's important to be culturally responsive because you need to understand what pressures people are experiencing, right? And so socio-political pressures are always relevant to our community. As a gay man, I experience different socio-political kind of forces that challenge my identity at times. And then, depending on if you hold multiple identities underneath the queer umbrella, you can experience those things even more so, right? They become heavier. And so, it's to recognize that as a provider, that's being culturally responsive. Right. You're responding to what the person is bringing in front of you from a societal context, but also from a deeply personal context as well. And you're trying to help them make sense of that.
Oh, that's really powerful. So here at NorthPoint, what are some of the examples of how our providers offer respectful, inclusive, and culturally competent care?
Well, I always say this. I choose NorthPoint every single day. NorthPoint is a place where I want to show up and work and be with the colleagues that I have and work with the people that I'm afforded the honor of working with. NorthPoint is special. Anybody who's lived in the community in North Minneapolis recognizes that, all the way back to when it was named Pilot City. I think we're 53 years ago now. So it's a pretty special place. One of the defining factors of NorthPoint is that they have always been culturally responsive, right? That is action-oriented. That is not just a buzzword for the day. It is something that NorthPoint lives and breathes. Do we get it right all the time? Absolutely not. We got to, we have to hold ourselves to our account too. But we recognize that, which I think is an important ingredient in providing really inclusive care, right? If you're going to be responsive to the community needs, you also have to recognize where your growth edges are. And so NorthPoint does a really nice job at that. It's to speak specifically to queer folks, we haven't always done a great job. Hence the reason why the committee was formed in 2018. Administration listened to clients who were coming in, also listened to the providers who were providing services to folks, and realized it's like, hey, we haven't been really responsive to the queer community. What can we do better? We held some listening sessions, and over that course of time, we developed what's now known as the 2SLGBTQIA+ committee.
Okay, right.
And really what that was a committee formed to just identify where those growth areas are, right? What do we need to do better in order to provide high quality care, which is what we pride ourselves on. And so that's kind of what we've done in order to be more responsive.
I love that. And, we really pride ourselves here at NorthPoint on being the keepers of our community, right? And I love that inclusivity, that, like you said, the need was brought to the forefront. And, we involve the community with listening sessions and getting that feedback about how do we get better. Right, that growth point that you talked about. I want to go back to something you said about the misconceptions. Let's talk a little bit more about that. Can you expound on that for me?
Yeah, there's a number of misconceptions that float around depending on what circles you interact with, what things you're watching on television, what news sources you are exposed to. I think gender affirming care has become at times a political football. It's been a pretty heated and charged discussion, just locally as well. And then there's this kind of there's misconceptions that live within the medical realm, and then also the mental health realm. I can't speak a ton to the medical realm because I'm not a medical doctor, and I don't want to reduce or diminish the really serious things that they've had to navigate. But I can speak from a mental health lens, and what I've noticed is it's been mostly centered right now on young folks. Young folks who are starting to grapple with their sense of self, and their identities are pretty new, right? And then parents coming in when it comes to a topic of gender and the questioning of gender or questioning of sexual orientation, and parents not being equipped with the education or information to respond to the needs of their child, right? And so what I'm really doing in those first sessions with young folks is helping them understand that I need to build an alliance with your parents, but I also need to build an alliance with you. And it becomes very challenging, but it's beautiful work that you get to do, right? Because you're really starting to bring the system, the family system together, and whoever is in that young person's life, and bring them into the understanding of gender is much more expansive than we realize. And so one of the misconceptions is that it's like you can only act male this way, or you can only act female this way. And there's many different ways to express just within the binary how to be male and masculine and how to be female and feminine, right? And a lot of times those things overlap and blend. And then to help people move forward even deeper in their understanding of gender, which is there's more than just being male and female, right? At times you may wake up and you feel very much in alignment with your gender. And there may be times where you feel not aligned at all, and it can be confusing. And to help a young person develop that sense of self earlier on helps them be more cohesive in their sense of self as an adult.
Yeah, that's so important. I know as parents, that's our role. We want to protect our children. We want to help them with the different transitions that they face as they grow and mature. And it sounds like this is, what we're doing here is we're really equipping our families on, some best practices and to really bring some things to light about here's what you might be facing so they can be proactively ready in those situations.
I always assign homework to people who are struggling with, either a young person or even an elder who's coming out for the first time. And I always charge them with this. I want you to think about everything that makes you certain about your masculinity or your femininity. What force has helped you make sense of that? Who reinforced that for you over time? Who are the people you looked up to in order to start to understand how you make sense of that identity component, right? If you can start there, you start to look at like, oh yeah, why do I do these things as a man? Or why do I do these things as a woman? Right? And then start to think about the steps you take to affirm that every single day. What clothes are you choosing to wear? Where do you choose to shop? How do you choose to present yourself? Do you use inflection in your voice? Do you use hand mannerisms? These are all things you're doing as just a human being in order to affirm your sense of gender. And so to really, really kind of start to take a inventory of sorts about what it means.
I also know, and you're on the behavioral health side, but I think there's also some maybe preventative care too that our community needs to be aware of, like maybe PrEP, for example. Can you talk about that a little bit? Some of those types of preventative care that we need to be aware of?
PrEP came into more of the conversation, I would say, about 3 to 4 years ago. I may be off on that a bit. But essentially what it is it is a pharmaceutical that helps prevent the spread of HIV specifically. I do want to be clear that it doesn't prevent the spread of any other STD, especially bacterial infections, but it was invented in order to help to reduce the spread of HIV. When it's taken consistently, it's about 99% effective. Okay, so you take it as prescribed. And so anybody, regardless if you identify within the queer community or not, if you're sexually active, having multiple partners, it's a good conversation to have with your medical doctor if PrEP is right for you. Recently, PrEP was a pill that you took daily. But they have come up with more innovative ways of delivering PrEP, and so now you can take it from an injection, and it's it's 6 times a year, so it's every other month. And so there's different options for folks to explore and see what's right for their daily routine. The other thing, there's for more of the bacterial infections from an STD, STI perspective, there's a preventative healthcare, which is called DoxyPEP. And DoxyPEP is another just kind of a form of medication that if you are feeling you've been exposed to any type of bacterial infection from an STI lens, whether that be gonorrhea, chlamydia, or the other bacterial infections, you can take that within 24 hours, and it greatly reduces your chances of developing symptoms and contracting a bacterial STI.
So thank you for that information. The reason I asked you that is I don't know how many of our young people are listening to this podcast. So maybe bringing that question up was for those that support caregivers, friends, folks in the community, the aunties and uncles of the community, but having an understanding of how we can support our young people and our queer community. Being here at NorthPoint, our providers are versed in all of this. And so I want to bring it again back to NorthPoint to say, if you are someone who doesn't have a parent or someone who is not helping you navigate through that, we are here as a beacon for that, right? So if I want to get connected, what would be the best way for me to do that?
Yeah, if you're wanting to look for services, we have a lot of services at NorthPoint, and so your best way is to call in. Once you establish care here, we're pretty quick about our response. So if you're looking for mental health services, or if you're looking for medical services, dental services, optometry, you name it, it's all under one roof. And so once you're registered as a patient, your services are pretty quick.
Okay.
For preventative care, like we're talking about with around STIs, STDs, I just want to let folks know there's still a lot of stigma that surround the contraction of an STI, STD, which prevents people from actually going to their medical providers, asking for the tests, and then receiving the care that they need. And it's that shame that they're carrying with them, right? STIs and STDs are more prevalent than most people realize. Regardless if you're from the queer community or not, I have a lot of folks come into my office, and being the type of environment that therapy is, people reveal a lot about themselves, and that's a very common revelation where it's just, hey, I'm having this symptom. Can I talk to you about that? And I'd be like, I'm not a medical professional, but I do have knowledge within STI and STDs that impact the community. We can have that discussion.
And that's what I was going to ask you too. What kind of support systems do we have outside of seeing a behavioral health clinician or a medical doctor? Do we have some other support systems in place?
I think it all comes down to the dissemination of information. Information is really vital, right? We did have a Pride event. It was our first annual, which it was a big success, and we were excited about it. But what we ended up doing was bringing together a lot of organizations within the community in order to start understanding who the people are who are providing this care. Because we're one entity and we're part of a large community, and there's lots of resources that nobody knows about. You know, it's been really kind of a gift to be able to start building these bridges and partnering with other agencies within just the metro, because then I get to spread the word.
Yeah.
Right. And that doesn't have to be a client of mine. It could be someone calling me up from another agency and being like, hey, I'm looking for this service. Do you have it? No, we don't. But I know so-and-so does down the street.
Right. Exactly. Yeah. So talk about that event a little bit. What was it? How did it come to be? You know, you were a huge champion of making that happen here. Yeah.
So the NorthPoint Pride event originally came to be it was really focused on health and resourcing, health and wellness around resourcing the community, right? We wanted to help people within the community understand where the resources are, what's available to them, so you're not having to piecemeal your services together. What we were realizing at NorthPoint, where we were helping clients or guests come in and then trying to get them connected to other resources around the community, and it was a lot of work. So we wanted to bring everybody together in one space. Pride happened to be a nice vehicle for that, in order to help people understand what was out there for them.
So we have the large Pride event that happens every year annually in Minneapolis, and then now we have our Northside Pride event, right? And so I love that is specifically about connecting individuals with resources, and like you said, building those bridges, so that, you know, we really have equipped ourselves to be able to speak to, if we don't have it, I know who has it.
Exactly.
Right? Yes. Yeah. Okay. Wonderful. Good. Let's see. In what ways do you feel society as a whole can benefit from supporting and expanding access to gender affirming care?
It's a big question.
Yeah.
I think the expansion of gender affirming care is, let me bring it back again. If somebody's struggling just with what it means to be female, what it means to be man, and there's different cultural dynamics that are involved, especially we work across a lot of different cultures, a lot of different ethnicities, and what it means to be a woman or a man is expressed differently depending on those other contexts. So anybody coming into my office, we can have those conversations, right? We can have conversations around what it means for you to identify from a certain gender, right? So we're already doing gender affirming care within the cisgender community, right? When we do gender affirming care specific to trans folks, right, then it becomes a bigger issue, right? We got politics involved, we have all these misconceptions and misunderstandings, and it becomes a bigger deal than it actually needs to be. Right? Yeah.
It gets convoluted.
It gets convoluted. Yeah. It gets conflated with other things. People shut down in the conversation. Like, I just don't understand. And those aren't entry points into a discussion. Those are walls. Right? Yeah. And when we have those walls up, it's really, really hard to provide the services that we needed to provide. Right? I tell people all the time, they're not coming into my office for me to change their gender. Yeah. It's for them to understand their gender more completely, right? To understand themselves in a more cohesive way, and to be able to integrate that so that they can live life the best way they want to.
Yes, a more fulfilled life.
A more fulfilled life.
And that's what we want. We want for our community. Let me ask you, because we just have a few minutes left, is there anything you feel we didn't talk about that's important, something that's on your heart that you want our viewers to hear from you?
If you have any person struggling with your sexual orientation, gender, gender expression, there are resources out there. There are people who want to help. There are people who have invested their life in developing the educational foundation in order to provide really high quality services. We have that at NorthPoint. We have many providers beyond myself who have taken all the trainings, have the certifications to do this type of work. You're not alone. And and what I see is what gets in the way the most is fear. It is fear around what's going to happen if these services go away. What's going to happen if this person is getting bullied at school, or they're an adult and getting harassed at work, right? This is just one more layer now that they have to deal with. If you can confront that fear and you can come in and seek services, you start to see that reduce and your world open up. There's a lot more possibilities out there.
I love that. So for those of you listening, and thank you, Dr. Gatermann, for that powerful message, don't let fear keep you from seeking services. Because we want you to live a fulfilled life, and we here at NorthPoint, we're focused on your health, your overall well-being. So thank you for listening to NorthPoint Making Health Happen. We want you to know that we're here to partner with you in creating a healthier community. Thank you, Dr. Gatermann.
Thank you.
Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know that times get hard.